I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Tens of millions of Americans were infected with the coronavirus. Most have recovered, but many are now long haulers. This is the People's Pharmacy with Terry and Joe Graydon.
Post-COVID syndrome can cause symptoms such as brain fog, fatigue, and shortness of breath. Then there's a mysterious condition called postural orthostatic tachycardia syndrome. It's abbreviated POTS.
Symptoms of POTS include dizziness on standing, rapid increases in heart rate, headache, difficulty exercising, and poor concentration.
We'll talk with a physician who's suffering from POTS and another who specializes in treating this condition.
Coming up on the People's Pharmacy, combating the long-lasting effects of post-COVID syndrome.
In the People's Pharmacy Health Headlines, the FDA's action in pausing the administration of the Johnson & Johnson COVID vaccine is controversial. Approximately 7 million people have received this shot. 6 women have developed dangerous blood clots and 1 died. The AstraZeneca vaccine, which is not approved or used in the U.S., is also associated with serious blood clot reactions in rare cases. Both Johnson & Johnson and AstraZeneca use a viral vector, an inactive adenovirus, in their vaccine, instead of mRNA like the Moderna and Pfizer vaccines.
Many people are confused about why the health authorities would have stopped administration of an effective vaccine in the face of a surge of cases. The FDA has suggested that they're pausing out of an abundance of caution. Some experts applaud the decision as prudent, bolstering public trust while the agency investigates. The CDC believes this action will alert patients and health professionals to the clotting concern and encourage them to report any additional cases.
Other specialists believe the FDA is putting people at risk by stopping the rollout of a crucial vaccine when it doesn't even know whether the blood clot complication is actually caused by the shot. While the agency investigates this potential problem, states are struggling to figure out how to protect their citizens from the new variants of the coronavirus that are spreading rapidly.
Public health authorities are striving to vaccinate as many people as possible as quickly as possible. The race between the variants and the vaccines is neck and neck. Over the last week, COVID infections have been rising in more than half the states. Michigan is in bad shape, but a number of other states are also reporting surges. Overall, new cases and hospitalizations have been rising over the last 2 weeks.
A study in England has shown that a common asthma drug, budesonide, can help older people recover from COVID-19 more quickly. Early in the pandemic, clinicians worried that people with asthma or other lung problems would be especially susceptible to the ravages of the coronavirus. Surprisingly, though, they actually seem to be at lower risk for severe complications. One hypothesis focused on the inhaled corticosteroids such patients routinely use. A randomized controlled trial with more than 2,600 patients participating showed that budesonide can be helpful. Patients using the corticosteroid inhaler recovered 3 days faster on average than those on usual care. In addition, only 8.5% of patients in the budesonide group required hospitalization, compared to 10.3% of those under usual care. Inhaled steroids are commonly used in the treatment of both asthma and COPD, and budesonide is widely available at reasonable cost.
Commonly prescribed antibiotics called fluoroquinolones can cause life-threatening blood vessel complications. Drugs such as ciprofloxacin and levofloxacin can trigger aortic dissection and aortic aneurysm. If the aorta leaks blood or bursts, it's a catastrophe. A new study from Taiwan shows that people who already have aortic diseases are more susceptible to the dangers of fluoroquinolones. An accompanying editorial in the Journal of the American College of Cardiology urges physicians to avoid prescribing such drugs in patients at risk for aortic complications.
Depression is common, debilitating, and sometimes challenging to treat. Antidepressants can take several weeks to have an effect. There's growing interest in psychedelic compounds such as psilocybin derived from mushrooms. Several studies, including 4 randomized controlled clinical trials, have reported that 2 treatments with psilocybin led to improvements in symptoms of depression. A new study compares psilocybin to a standard antidepressant called escitalopram, brand name Lexapro. After 6 weeks, both groups reported less depression. The treatments were equally effective. Adverse events were also similar in both groups, but the psilocybin caused less anxiety, dry mouth, or sexual dysfunction. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
At last count, more than 31 million Americans have contracted COVID-19. Globally, the case count exceeds 138 million. There's growing concern that many of the people who recover from the coronavirus will continue to suffer long-lasting complications.
Such individuals sometimes refer to themselves as long haulers. Healthcare professionals may talk about long COVID or post-COVID syndrome. What symptoms have been reported? How are people coping with this often debilitating and confusing condition? We're talking with a physician who has personal experience with post-COVID syndrome. We'll find out about a condition called postural orthostatic tachycardia syndrome. It's abbreviated POTS, POTS. Later in the hour, we'll talk with Dr. Christina Cocorellis. She's a member of the Johns Hopkins POTS program. As a rehabilitation physician specializing in pediatric and adult POTS, orthostatic intolerance, and musculoskeletal rehabilitation, she takes a comprehensive team-based approach to patient care. She's an assistant professor in the Johns Hopkins Department of Physical Medicine and Rehabilitation.
But first, we turn to Dr. Shannon Casperson. She is triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. She treats patients with depression, anxiety, eating disorders, and substance use disorders. Dr. Casperson is an assistant professor at Weill Cornell Medical College, New York Presbyterian Hospital.
Welcome to the People's Pharmacy, Dr. Shannon Casperson.
Thank you so much for having me today.
Dr. Casperson, could you please tell us about your experience with COVID-19, please?
Sure. So a year ago today, actually, was the first day I didn't go into my office to see patients there. And I just took it as a sick day because I was really not feeling well. I had a sore throat and a headache and body aches. And I just thought, you know what? No one knows very much about this COVID thing, but I'm going to be careful and not go to work since I don't feel well today. And it turned out that was the last time I saw anyone in my office. I started seeing patients from home the next day, and my symptoms got worse. And over the course of the week, I was doing kind of telemedicine appointments, not only with my own patients, but with my primary care physician. And eventually, when I started having kind of shortness of breath and chest pain, they said, you should go to the ER. So I went to the ER at my hospital and where I'm on faculty. And it was early, right? It was the beginning of March. So there weren't tests were really, really being limited. The CDC, they had to get any test they wanted to do on a patient, they had to get approved basically through the Department of Public Health. So they kind of dithered about whether to test me or not. And then they finally decided to. So they tested me and sent me home. And a couple days later, I got my result, which was actually negative. And I started to feel better after a week or two, and started kind of returning to normal activity. And then the long hauler symptoms started to set in. Of course, at the time, I didn't know what that was. I didn't, no one did, but they progressed on. And a year later, I've learned a lot, and am overall doing better. But it's been quite a journey.
What were the first symptoms that showed up as long COVID symptoms?
So the first thing I noticed was that I was doing I'm someone who, at baseline was, exercised most days of the week, did a lot of gym classes and that kind of thing. And I was doing a little like kids workout video with my 6-year-old daughter about 2 weeks after I'd gotten sick. And I was incredibly short of breath, like really panting away just after a few jumping jacks, which was strange to me. But I thought, I guess I'm deconditioned from, being sick. And then the next day I had a profound headache, as someone who had never really gotten headaches before. And then from there, it progressed. I had frequent shortness of breath, dizziness, numbness and tingling in my arms and legs, muscle aches, joint aches. And all of these symptoms kind of waxed and waned over the next several months.
Dr. Casperson, when did you realize that this was something that is now called post-COVID syndrome?
Working with my doctor and reading all of the articles, particularly the Atlantic Monthly had been doing really good coverage of people who weren't getting better from COVID. We kind of put it together by and I should also say some of the online forums started by a New York Times journalist, Fiona Lowenstein, called Body Politic. So just reading about other people's symptoms, and we were all kind of figuring it out together. And by June or July, it seemed like that is probably what was happening with me. And, that's what my primary care doctor thought. I was referred to a neurologist for some of the neurological symptoms like the numbness and tingling and pain in my hands and feet. She also thought it was like a post-viral kind of picture. And then I started to read about other patients' experiences with dysautonomia. And it sounded like a lot of our symptoms were similar to those of dysautonomia patients, dysautonomia is a general term for the disorder of the autonomic nervous system, which is the part of the nervous system that controls things that we are not aware of. So our breathing, our heart rate, our blood pressure, our temperature regulation, things that are happening all of the time and are controlled by our brain, but not our conscious brain or our voluntary nervous system. And, I was reading about dysautonomia, and it wasn't something that really was touched on in any depth in medical school. And, I've had to sit for numerous sets of boards that are about neurology and psychiatry over the year, given my specialty. And I just didn't know very much about dysautonomia. It's not really talked much about. But I did some of the quick and dirty tests you can do at home on your heart rate, basically seeing how much your heart rate goes up from when you're in a lying down or supine position to a standing position. And it seemed like my heart rate was changing enough that I might meet criteria. And then I went to I saw a doctor, a cardiologist who happened by chance to have a lot of experience with this particular kind of dysautonomia and was able to diagnose me and start some treatment.
Now, this particular kind of dysautonomia in which your heart rate doesn't behave itself properly, it has a long, fancy name. Can you tell us about that?
Sure. It's called postural orthostatic tachycardia syndrome and is nicknamed POTS, which is just the acronym of those 4 words. And basically what happens is that your autonomic nervous system, which controls the contraction of blood vessels throughout your body to return blood to the heart, is malfunctioning. And so blood stays in the extremities instead of getting circulated back to the heart. And to compensate, the heart beats faster and faster and faster, trying to pump that blood back. So you can get really elevated heart rates without exertion. And the postural piece is that when any of us, when a normal, healthy human goes from lying down to standing up, blood pressure and heart rate change automatically, thanks to the automatic nervous system, to fight gravity. But when you have POTS or another dysautonomia, that kind of reflex doesn't work. So your heart rate, which at rest, lying down, might be 60. Most people, when they stand up quickly, their heart rate might go to 70 or maybe closer to 80. But with POTS, it could go from 60 to 120 or 150. And there are all sorts of symptoms that go along with the kind of lack of proper blood return. So you get not only the racing heart, but you can feel short of breath. You can feel dizzy. People often actually faint, because basically what fainting or syncope is just a lack of blood flow to the brain. And so the body tells itself, get horizontal again. And that's what fainting does. I mean, fainting is an intentional response, if you will, on the part of the autonomic nervous system to bring someone back down to latitude in which their blood can get to the brain. So people get faint. Sometimes they actually do faint. This idea of brain fog that seems pretty common in long haul can definitely be associated with POTS. And again, it's a lack of blood flow to the brain. And then there are other symptoms, GI symptoms that some people have. I never had, but that's due to a lack of blood flow to the digestive system. So their symptoms can get worse after a meal when blood wants to flow to the digestive system, but it's pooling in the lower extremities. It's a complicated illness and it's not perfectly understood, but there are a few people around the country doing research on it, and they're getting a lot more funding now, given all of the long haulers walking around or not walking around with POTS.
You're listening to Dr. Shannon Casperson, who's triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. Dr. Casperson is an assistant professor at Weill Cornell Medical College, New York Presbyterian Hospital.
After the break, find out how people with post-COVID syndrome are dealing with the nervous system problems like brain fog or memory lapses.
What are the challenges of managing long-lasting effects of the infection?
How do doctors treat POTS? It's not a condition most physicians know a lot about.
How difficult is it for people to get a diagnosis of postural orthostatic tachycardia syndrome?
The online forum Body Politic has been helpful for many people with this condition.
Is our medical system ready to help people with post-COVID syndrome, or will it be overwhelmed?
Dr. Casperson offers her advice to those who think they might be suffering from POTS or other post-COVID symptoms.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
You've probably heard us talk about the many health benefits of cocoa flavanols and some of the recent scientific research that's come out about how these powerful plant-based compounds can improve your memory.
We've been fans of Cocoa Via supplements for years because they contain the highest levels of cocoa flavanols on the market and have been independently tested for quality. For those of you that are curious about how cocoa flavanols can improve your memory and heart health, now is the time to try them.
Cocoa Via is offering up to 35% off supplements site-wide. including Memory Plus, which has been shown to improve 3 different aspects of memory. Go to CocoVia, that's CocoVia.com, to take advantage of these limited time prices. Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon.
The People's Pharmacy is brought to you in part by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYA Biotics.com.
Also by CocoVia Memory Plus, a cocoflavanol supplement backed by 4 clinical studies that show significant improvement in 3 different aspects of memory. More information at cocovia.com.
Today, we're discussing how to combat the long-term effects of post-COVID syndrome. A number of people suffering from long COVID experience a complication called POTS, postural orthostatic tachycardia syndrome. That's our focus for this episode.
Our guest is Dr. Shannon Casperson. She has expertise in adult psychiatry, child and adolescent psychiatry, and addiction medicine, and treats patients with depression, anxiety, eating disorders, and substance use disorders. Dr. Casperson is an assistant professor at Weill Cornell Medical College, New York Presbyterian Hospital. She has personal experience with post-COVID syndrome and particularly POTS.
Dr. Casperson, you are a psychiatrist. You also have a lot of experience in the field of neurology. And so I'm wondering how people are dealing with the central nervous system complaints such as brain fog, anxiety, memory problems. I suspect some people are dealing with PTSD symptoms after either being in the intensive care unit or on a ventilator. So can you describe some of the challenges that people in the support group are reporting or that you have personally experienced? Because a lot of folks who are experiencing long haul syndrome, they were doing really well. They were healthy, they were younger, and now all of a sudden their lives have changed.
Sure. So I should start by saying that I was really fortunate in that my long haul and my POTS did not manifest with brain fog or anxiety. I think this was perhaps because given my specialty, I'm always sitting down to work. And so I, had better blood flow to my brain, despite the POTS, than someone who has to be on their feet all day for their jobs or taking care of kids or whatever. So I was really fortunately spared. But yes, on my support groups and just talking to, after I wrote the New York Times article, so many people reach out to me. So I've had a lot of conversations with fellow patients who did suffer with the brain fog. I think, people sometimes describe it as feeling like they have early onset dementia. And when I say early onset, they're 30. So it's clearly not dementia, but it feels like their short-term memory goes. They can't think clearly. They can't focus well. They get confused. They forget what they're doing. I remember people talking about in their professional lives, tasks that were just second nature, they suddenly couldn't remember how to do, which is pretty terrifying and anxiety producing. And then, of course, feeling like you're physically infirm, like you could faint at any moment, or you're not steady on your feet, because POTS can also cause tremors. So people are literally shaking. So they feel shaky on their feet. That can also cause anxiety, especially if you're someone who is used to operating on all cylinders physically and cognitively. And then there's another piece of anxiety, which I think was pretty widely held by long haulers, which was not knowing what was happening to you and not having doctors be able to tell you what was happening to you or what should be done about it. This is a brand new illness. There are good diagnostics for some kinds of dysautonomia, but they're not well known or widely understood by a lot of physicians. So people would go to the doctor, they would have their vital signs checked when they're sitting down, and their vital signs would look fine sitting down, and their blood counts and things would all look normal. And the doctor's like, I don't know what's wrong with you. But you probably just have anxiety about the pandemic, or you have PTSD from having COVID or something like that. And while certainly everyone's got anxiety about the pandemic, and possibly, you could have some PTSD type symptoms from being in an ICU or on a ventilator, it's to be told that your symptoms are psychological when they feel very physical is incredibly discouraging and frustrating for patients. As a physician myself, I was able to advocate for myself and, understand the research that I could read about dysautonomia and stuff. So I think I was in a better position than the average patient. But even for me, at one point, my doctor, who is someone that refers patients to me all the time, I refer patients to, we've known each other for many years. At some point, he said to me, I think you have anxiety about the pandemic. And I said, I wish that's what it was, because I know how to fix that. I'm a psychiatrist. Anxiety is what I do, but unfortunately, I don't know what to do about my heart rate going to 160 when I stand up. So even for someone who's very well informed, this kind of it must be anxiety piece was happening. And the funny thing is, I didn't really feel anxious because I knew none of this was life-threatening. It was just really hard to function. But for many people, you feel these symptoms and you're afraid. What could this be? So I think there's a huge psychological burden. And because the post-COVID syndrome has a really waxing and waning pattern, people have a few good days or a few good weeks, and then something will trigger, what people would say is a relapse or just a worsening of symptoms. It can be really discouraging. You think you're getting better, and then boom, you're back to square one. So huge, huge psychological implications, even if you're not suffering from the frank brain pathology of POTS.
Now, Dr. Casperson, what I'm wondering is there a treatment for POTS? Is there something, whether it's medicine or some kind of lifestyle approach, that can help you and other people suffering from this dysautonomia feel better?
Yes. So there are treatments. There is no cure. There is not, one medicine that you take that will make it better. We don't know even the specific mechanism which causes POTS. There's some thought that it's autoimmune or that it's an inflammatory reaction, among many other theories. So it's really symptom treatment and compensating for the parts of the body that aren't working well. So in terms of lifestyle interventions, people are encouraged to wear compression garments, so like compression tights, to help sort of push the blood back up to their heart. People are encouraged to eat a really high salt diet, like several grams of salt per day, and to drink large volumes of water. Doing so increases the blood volume so that it's easier for the heart to keep pumping it through. There is an incredible exercise rehabilitation program that was created by a Dr. Levine, actually at the Children's Hospital in Philadelphia, because POTS, before COVID, POTS was something that tended to happen to adolescents and young adults. And it's an exercise program. It's about 8 months long, and it starts with doing exercise literally lying on the floor. And eventually you build up over time to, an hour several times a week on a treadmill. But you go from the floor to a recumbent bike to a stationary bike or rower to a treadmill, slowly increasing the verticality as you kind of retrain the body to manage a vertical stance. So that's incredibly helpful because it gives a roadmap for patients. It's sort of like, if I follow this, I will start to feel better. And then there are some medications that, again, are symptom targeted. There's a mineral corticoid called fludrocortisone that helps you retain salt. So it helps with that blood volume piece. There are heart medications like beta blockers and similar medications that can help with slowing the heart rate, which can reduce symptoms. And then there's some medications that work directly on blood vessel constriction, like Mestinon. So it's really just a lot of trial and error to see which of these interventions is helpful. But those are kind of the gold standard, are those the salt, the water, the compression, the exercise, the rate control medications, the constricting medications, and the mineral corticoid.
Dr. Casperson, you mentioned that this is not a condition that most medical students learn about. And I suspect that there were a lot of people who had POTS before there was a pandemic. And now, perhaps thanks to the pandemic, maybe POTS is getting a little more attention. But I'm wondering if there are a lot of people out there who have basically gone undiagnosed or misdiagnosed in the past and are hearing your description for the first time and wondering, well, maybe that's what I've got.
Yeah. I mean, the average time from onset of symptoms to diagnosis with POTS for patients in the U.S. is 7 years. So it gets misdiagnosed all the time. And that's not anyone's fault. You know, I think in medical schools, they have a lot of things to teach us, and they're going to teach us the things that are well understood and have a good treatment plan. And probably at a lot of schools, they flashed a slide during the dysautonomia lecture about POTS. But, you know, one slide out of a million in med school is not going to stick with a lot of people. So it does get misdiagnosed an awful lot, and it can come in all sorts of severity. So there are people who are so debilitated by their POTS that they cannot get out of bed. And then there are people who are functioning fully, but, you know, maybe they get dizzy every time they stand up, and it doesn't really impact their functioning, so they don't think so much about it. There's a huge range. But yes, I hope that the pandemic does bring more attention to dysautonomias, because they are probably more common than we realize.
Dr. Casperson, in the previous segment, you mentioned an online forum called Body Politic. Can you tell us a bit more about it, please, and how it helped you?
Sure. So, as I said, it was started by a New York Times journalist who was, I think she was 28 when she got COVID back in the end of March. And she wasn't really getting better, sort of towards the end of April. And she wrote this article in the Times and had also just started this support group. And I will say I have never been in a support group or joined an online forum, I don't think ever in my life. But I did join this one because I was, so curious and looking for answers. And it has grown into an international database, I would say, of symptoms and treatments and test results and physician recommendations. And it's just a huge community where people compare symptoms and treatments and time courses, and there are different channels within it. So, I don't really check the gastrointestinal channel because I never really had any of those problems, but I was very keyed into the dysautonomia channel. And when it came time, when I became eligible for a vaccine through my hospital, I was very interested in the discussion of vaccines because some long haulers were really concerned that vaccination might trigger a worsening of their symptoms. So it's just been a great resource for long haulers with all different kinds of symptoms around the world. I don't know how many thousands of people are on it now, but I'm guessing it's hundreds of thousands at this point.
Dr. Casperson, you bring up the point of big numbers. I mean, there are over 20 million people around the world who have contracted COVID-19. And a substantial number of them may very well end up with post-COVID syndrome, this long hauler problem. I'm wondering if our medical system is ready for you all.
Yeah, it's been something I've been asking since last spring. The current estimates are that from 10 to 30% of people who have COVID end up as long haulers of some form. And, there are a few clinics around the country and the world that are dealing specifically with long haulers, but they have very long wait lists. And people and the treatments, I should say, are, as I described for POTS. I mean, not everyone has POTS from COVID, but they're slow going. It's not like someone, has a sore throat, you give them an antibiotic and they get better. It's a months-long process. And I don't think our healthcare system is ready for it. I worry so much about people who cannot do their jobs with these symptoms. As I've said, like, I sit around seeing patients all day, but if I were a hairdresser or a construction worker or a host in a restaurant, forget it. By now, I've been working on getting better for a year, but a few months ago, I would not have been able to work. And is everyone and all these people going to have to be on disability? What's going to happen to the people they take care of? It's really staggering to think about.
Dr. Casperson, we're almost out of time. Can you offer any advice to people who suspect that they may be dealing with post-COVID syndrome or POTS?
Yeah, I can offer advice not as a physician, but as a fellow patient. You can't push yourself because you will feel sicker again. So I think that rest and copious amounts of sleep and hydration and sort of acceptance that this is going to take a while are the best pieces of advice I can offer, especially given, who's tending to be affected by long COVID are people who are kind of young and healthy and in the prime of their productive lives. It's hard to rest, but I think it's essential.
And one more time, the support group that you have relied upon?
Yeah, it's called Body Politic. And politic is spelled with a CK at the end. So if you just Google Body Politic, it's actually a Slack group, but Googling Body Politic COVID will get you right there.
Dr. Shannon Casperson, thank you ever so much for talking with us on the People's Pharmacy today.
Thank you for having me.
You've been listening to Dr. Shannon Casperson. She is triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. Dr. Casperson is an assistant professor at Weill Cornell Medical College, New York Presbyterian Hospital.
After the break, we'll talk with Dr. Christina Kokorellis of the Johns Hopkins University POTS program.
Dr. Kokorellis will explain much more about postural orthostatic tachycardia syndrome.
Why is POTS more common in women, and how challenging is the diagnosis?
Dr. Kokorellis will tell us about the treatments she recommends.
We'll also find out what she'd like her colleagues to know about this condition.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. Kaya Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's Kaya Biotics.com. Use the discount code PEOPLE for $10 off your first purchase. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. KAYA Biotics.com.
Also by CocoVia Memory Plus, a cocoflavanol supplement backed by 4 clinical studies that show significant improvement in 3 different aspects of memory. More information at cocovia.com.
Today, we're focusing on one of the complications of post-COVID syndrome that may linger long after people recover from the acute infection. We're talking about an autonomic nervous system disorder called postural orthostatic tachycardia syndrome, often abbreviated POTS. How does this condition affect people's lives, and what can be done to combat it? It's showing up as part of long COVID, but people have been suffering from POTS for years.
Our guest is Dr. Christina Cocorellis. She's a member of the Johns Hopkins POTS program and an assistant professor in the Johns Hopkins Department of Physical Medicine and Rehabilitation. She's a rehabilitation physician specializing in pediatric and adult postural orthostatic tachycardia syndrome, orthostatic intolerance, and musculoskeletal rehabilitation.
Welcome to the People's Pharmacy, Dr. Christina Cocorellis.
Thank you for inviting me today.
Dr. Cocorellis, we've just heard from Dr. Shannon Casperson. She described her experience with post-COVID syndrome, especially POTS, P-O-T-S. Could you tell us a little bit more about this thing that is referred to as postural orthostatic tachycardia syndrome?
Sure. It's a mouthful, but you did a great job of saying that. So POTS is a condition that we've been treating actually for many years now, and it's characterized by symptoms such as fatigue, dizziness, lightheadedness, brain fog, nausea, and all of these symptoms tend to get worse in an upright vertical position and improve when lying in a horizontal position. And the upright position is accompanied by tachycardia, which means a fast heart rate.
Why? Why does this happen?
That's a great question. So there's still a lot of research ongoing with POTS. What we know so far is that the thought is that at least half of cases are triggered by a virus. I've seen other cases triggered by concussion, a surgery, a stressful event in life, a pregnancy. So we don't always know why. The thought is maybe there's some type of trigger in addition to a genetic susceptibility, and then it kind of just flares things up. But yeah, the most common trigger would be a virus. And even before COVID, I think the most common presentation I would see is someone would come to my clinic and say, I was doing really well, and then all of a sudden I had a virus like strep or mono or GI bug, and then they really never recover, and they continue to have symptoms such as this dizziness, fatigue, etc.
We understand that POTS may be more common in women. Is that true?
That's definitely true. I would say probably 80% of my patients are females.
Now, we also understand that perhaps there are physicians who are not very familiar with this syndrome. Are there challenges in diagnosing it properly?
There are. I think one of the main barriers to diagnosing POTS is that the symptoms are kind of nonspecific and can fit many different things. For example, having chronic fatigue and lightheadedness and headaches is not very specific, right? That could be several different things. It could be a virus. It could be Lyme's disease, could be depression. It could be an autoimmune disease. So there's a lot of other things that can cause these kind of non-specific symptoms. And typically, I would say by the time a patient is seen in my clinic, they've had symptoms for at least 5 years. And during these 5 years, they've been to various specialists. They've gone through a lot of diagnostic testing to, be worked up for other possible etiologies. And typically, once all the other conditions are kind of ruled out, then, someone will mention maybe this is POTS.
5 years is a long time to suffer with something like that.
It is. I really feel for my patients because they suffer. They go to a lot of different specialists just to even get a diagnosis. I think sometimes that can be the hardest part, is actually getting the diagnosis. The nice thing about POTS is we actually have treatments and really effective treatment options. So a lot of times people suffer through symptoms, then they get the diagnosis. And then once we really start a treatment plan, things typically, improve. So that's the nice thing here.
Well, I recall talking to a patient 20 years ago who was diagnosed with chronic fatigue syndrome. And she basically said, look, I used to ride horses. I was really athletic. I did all kinds of physical things. And then one day I caught something. And within a couple of weeks, I could barely get out of bed. And my heart was racing. And I would get dizzy. And I'd have to get back into bed. And the doctors basically say it's all in my head, but I can't function. What's going on? And of course, we didn't have any answers. And our guest said, well, it sounds like chronic fatigue syndrome, but we don't know what causes it and we don't know what to do about it. Maybe in retrospect, it's POTS.
Well, maybe, but there's also a link between chronic fatigue syndrome and POTS. So actually, Dr. Peter Rowe, who's at Johns Hopkins, has found a link between chronic fatigue and this kind of presentation of having symptoms, orthostatic symptoms, meaning the worsening of symptoms in an upright position. So there's certainly a link. And I would say a large proportion of my POTS patients also have chronic fatigue syndrome. So they're not mutually exclusive.
So could you give us a sense of the full spectrum of symptoms? You've mentioned a few, but you've seen so many patients now. Can you describe, what the bell-shaped curve looks like in terms of the things that they're going through?
Sure. It is a spectrum. So you're 100% right. I would say I rarely see patients with very mild symptoms, but I do. And that would consist of, some lightheadedness, dizziness with standing. Typically, these patients, remain highly functional and can really push through their symptoms and just stay hydrated and stay active. But it is nice to kind of give them a diagnosis so they have an explanation for their symptoms. Then the other side of the spectrum, we see patients who are very, very debilitated, really to the point of being non-functional. So I have many patients who are essentially bedbound. But I would say most patients fall, somewhere in the middle where they have chronic symptoms that do impact their functioning to some degree.
Dr. Kokorellis, you mentioned that you have effective treatments, and I'm sure that is very welcome news. Could you tell us about that, please?
Oh, sure. So the way we treat POTS, so first-line treatment is actually with lifestyle changes, which means number one is aggressive hydration. So that is about 100 ounces of fluid per day. Doesn't have to be water. That can include any type of non-caffeinated fluid, which it's a lot. I don't know how much you guys drink in a day, but 100 ounces is a lot. On top
Not
of
that
that
much.
Yeah, right. Exactly. On top of that, we recommend a high salt diet. So somewhere between 4 and 6 grams of salt per day. Salt helps with fluid retention, so it helps us stay more hydrated. And, we can get salt into us through many different ways. Often the easiest way is through your diet, sprinkling salt on your foods, eating not necessarily processed foods, but foods that are higher in salt content, such as pickles, olives, pretzels, salted nuts, That's kind of an easy way to get it in. Many patients will add electrolytes to their drinks as another way to get salt in. And certainly I do have patients too who take salt tablets. And then in addition to the hydration and the salt, we always recommend wearing some type of compression socks or leggings, which should be very fitted. And in addition, really the mainstay and the best way to treat POTS is with physical activity and exercise. Really the limiting factor is that oftentimes my patients have so many symptoms that they really struggle with exercising.
So tell us a little bit about how you would recommend that kind of a program. What would it look like for somebody who says, whenever I stand up, Dr. Kokorellis, I get dizzy and I'm almost going to fall down. Mm-hmm. So how would you devise a program?
Right. So in addition to the hydration, the salt, and the compression stockings that we talked about, we would start them in an exercise program. So that can be done under the supervision of a physical therapist. Typically, what it will consist of, at least initially, is exercises in a recumbent position, meaning the patient will be lying down when they exercise. Exactly. And why is that? Because these patients feel better when they're lying down, but we still want them moving. So that's kind of where we start. And what does that consist of? So certainly it can consist of, leg strengthening exercises, core strengthening exercises with them, lying down. In addition, we do recommend starting some type of cardio. And a lot of times for these patients, it's just a little bit of cardio, meaning like we start with 5 or 10 minutes. And what kind of cardio can you do in a recumbent position? So recumbent bike is one option. A rowing machine. In a rowing machine, most of the time you're in a more horizontal position. And the third option would be something like swimming, where again, when you swim, you're in a horizontal position. So these are examples of exercises that are often better tolerated by a POTS patient compared to something such as, walking or an elliptical where the patient is more upright.
I'm assuming that you want these people to start gradually and then build up their exercise bit by bit. Am I making the wrong assumption?
No, you're absolutely correct. We do recommend the patient kind of starting with very, kind of a light, maybe like I said, 5 or 10 minutes of activity and kind of building their endurance up over time. And depending on how, the degree of their POTS and how debilitated the patient is, that will kind of depend on their plan. So they kind of have to take it at their own pace. There's not, one plan that will fit all of these patients because, as we've talked about, it is such a spectrum. So some patients are able to start, maybe they can do 15, 20 minutes of exercise, where some patients really struggle just to start with 5 minutes. But the key is really just to kind of follow the patient and let them take the progress at their own pace. But yes, the general trend is with time, the goal is to build up the amount of exercise.
Dr. Kokorellis, how well does the program work? If you had 100 patients who were moderately impaired because of postural orthostatic tachycardia syndrome, in other words, their heart rate goes up pretty high when they stand up, how many would say to you at the end of 6 months to a year, wow, what an improvement. I can function again almost as well as I used to. And how many would say, whew, not much better. I still can barely get out of bed and walk around the block.
I would say over half for sure. I would expect feeling significantly better and more functional. I think, like I said, part of the challenge for treating POTS is just getting the diagnosis to begin with. And then part of it is just sticking to an exercise plan when you feel, for lack of a better word, so crummy all the time. And it can be a very frustrating process because I had patients and they're like, look, I am drinking, I'm getting salt, I'm trying my best to exercise. And it's, a month or two in and they're like, I don't feel better. In fact, I feel a little bit worse. And my response is always, sometimes we might feel worse before feeling better, but we still have to keep at it. So it is a very long process. And sometimes, my role is kind of being a cheerleader for these patients and saying, you can do this. This is going to help you. We just have to be patient and keep at it. But I would expect that if someone really adheres to the program within 6 months to a year, most of them will feel a significant improvement in their symptoms.
And Dr. Kokorellis, what would you like to tell your colleagues, doctors who have perhaps never heard about POTS during their medical training, or even doubt patients who come in and complain of these symptoms? What should they know?
Well, I do feel for my patients. I have heard over and over that these patients get dismissed, and other providers will say, this isn't real, this is all in your head, because they kind of rule out the more common etiologies of these symptoms. And when they don't find anything else, they'll say, yeah, it's in your head. And it's not in their head, right? We have a way to diagnose, we have a way to treat, and it's a constellation of symptoms that we see over and over. It is certainly a syndrome. And I think, if there's a silver lining to COVID here, it's maybe bringing some more awareness to both the medical field, but also to the general population about POTS and what it is, because it is a fairly prevalent condition, but I think it's, very little recognition. So, hopefully that we will kind of learn more, and it will be something that, people can talk about and actually know what it is. Because I would say most people aren't familiar with POTS.
Is our healthcare system prepared for post-COVID syndrome and the POTS that can go along with it?
Well, I think we are. I think we could use some more providers who are knowledgeable about POTS and kind of post-COVID syndrome. So we've created clinics at Johns Hopkins and at the Kennedy Krieger Institute for Adolescents who are, these clinics are tailored towards these post-COVID long haulers. And some of the treatment is, focusing on POTS. But these clinics, have wait lists. There's a lot of long haulers. And I think it would be nice if we can get more clinics like this opened up across the nation to accommodate all of these patients.
Dr. Christina Kokorellis, thank you very much for talking with us on the People's Pharmacy today.
Thank you for having me.
You've been listening to Dr. Christina Kokorellis, a member of the Johns Hopkins POTS program. As a rehabilitation physician specializing in pediatric and adult postural orthostatic tachycardia syndrome, orthostatic intolerance, and musculoskeletal rehabilitation, she takes a comprehensive team-based approach to patient care. Dr. Kokorellis also treats children with concussions and chronic pain disorders. She's an assistant professor in the Johns Hopkins Department of Physical Medicine and Rehabilitation.
We spoke earlier with Dr. Shannon Casperson, a psychiatrist and assistant professor at Weill Cornell Medical College, New York Presbyterian Hospital.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC.
If you would like to buy a CD of today's show or any other People's Pharmacy episode, you can call 800-732-2334. Today's show is number 1254. That number, 800-732-2334, or place your order online at peoplespharmacy.com.
When you visit the website, you can share your thoughts about today's show. Have you experienced troublesome symptoms after recovering from COVID infection? Tell us about it at peoplespharmacy.com in the comments section of today's show notes.
You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. You might want to share it with a friend or family member.
At our website, you can sign up for our free online newsletter to get the latest news about COVID-19 and other important health stories. By subscribing to our newsletter, you'll also have regular access to our weekly podcast. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.